Thank you all so much for taking time to coming out on a Sunday afternoon. This is one of the, we typically offer our monthly community conversations over the weeknights, and we decided to change it up a little bit and try a afternoon, weekend afternoon. I think people are just slowly rolling in. David, are you there? Okay, perfect. Well, welcome everybody. I'm just going to let people in as they come in. My name is Emlyn Lee. I'm the founder of Brave Communities, and we are a local nonprofit here in Austin, Texas. But the beautiful thing about the virtual space is that we have people from all over joining us. So thank you for joining. Brave stands for Building Relationships, Awareness, Voices, and Engagement. And we've been hosting monthly community conversations for the past 5 years, since 2017. And so we're very excited for today's conversation. I'm going to hand it over to David Johnson, our moderator, and enjoy this first hour of our panel discussion.
Thank you, Emlyn. Thank you. Welcome, everyone. And I would like to tell everyone I'm so appreciative for you being here today and for being a part of our Brave Communities community conversations. Thank you to everyone on our panel for serving on today's Brave Communities conversation. Now, there's some Zoom housekeeping that I would like to bring up. Please note that today's panel discussion is being live streamed and recorded on Brave. It's being live streamed on Brave's Facebook page. However, we will not record nor live stream the listening circles that will follow the panel. And that's happening in the second hour of the show. Now, we invite you to share this panel discussion with your networks as more people can watch simultaneously. You can always go back to our Facebook page and our Facebook and our Brave YouTube page to watch the recording. In this Zoom meeting, we will spotlight the panelists speaking and ask that audience members keep their mics on mute, or you will be muted. We want this event to be as engaging and interactive as possible. If you have any questions, please feel free to use the chat board, and we will share them throughout the conversation with the panelists. And we'll be sharing the Brave Heritage Conversations poll on Zoom and in the Facebook chat. Now, Brave stands for Building Relationships, Awareness, Voices, Engagement. And our mission is to cultivate brave spaces for diverse people to come together and build relationships, awareness, voices, and engagement so we can co-create more just and equitable communities. We are grateful to offer this virtual space to provide an opportunity for us to safely hear the stories and voices of community champions around the states. A silver lining of holding spaces virtually is that it allows us to gather in community from all around the world. One of our panelists is joining us from Philadelphia and an alumni of our Brave Makers program, empowering teen girls to join community leaders and social change agents with a social justice and racial equity lens on the problems that we face. Please feel free to drop in the chat board where you are tuning in from. We'd love to know where you're at and who's viewing us from where. I'd like to give a moment for each of our panelists to provide a 1 to 2 minute introduction of themselves. And so first, I would like to name G.E. Lovelace. Please, G.E., tell us about yourself.
Absolutely. Hello, everyone. My name is Grant Lovelace, but you all may call me G.E. or G. My pronouns are he, they. I am the co-founder and executive director for Elevate Your Essence, a social enterprise dedicated to elevating the brand influence and voice of young people across Central Texas. Within this role, I have been able to touch a lot of beautiful minds that are youth and college students to be able to elevate their stories into action. And so that's what I do, and my purpose lives through Elevate Your Essence. And I'm just really excited to be here to have a conversation about health disparities that are aligned with the youth and college student voices and their stories. So I'm just excited.
Thank you so much, GE. Grant, but GE sounds like your spirit, so I'm gonna roll with that. Next, I would like to invite Jody McIntosh to tell us about themselves.
Thank you, David. I am Jody McIntosh. I am currently the Fuse Executive Fellow working within Travis County Health and Human Services. And my specific project is focused on vaccine equity. So making sure we have an equity lens at how we approach vaccines in the entire Travis County. I have developed the Vaccine Partner Program, which chooses to amplify the voices of community organizations like Brave and reimburse them for the work that they are doing with reaching out to folks who are considered hard to reach or in low vaccination areas. And the next 5 months or so, I'll be working on communications and campaigning specifically around the African American community. And like GE mentioned, I'm really excited to be here and share with you all.
Thank you so much, Jody. Pleasure to meet you. The next person I'm about to give an opportunity to introduce himself is someone that I already call a friend, full disclosure. So Marva Overton, would you please tell us about yourself?
Yes, good afternoon, and thank you, David, and thank you, Emmeline, for inviting me to be a part of this event today. So my name is Marva Overton. I'm the Executive Director of the Alliance for African American Health in Central Texas, and we are a nonprofit organization based here in Austin, really doing work at the community level around health promotion and trying to address these long-standing health disparities that we all know are alive and well. Personally, I grew up in Memphis, Tennessee, but I come to Austin by way of Dallas, where I lived for a while. And I have roots in Austin, even though I didn't grow up here, both of my parents did. So coming here to live was like coming back to a place where I, used to come as a kid. And it's changed quite a bit since that time, and even since the time that I've lived here. I really find myself in this space of working in health, not really intentionally. My background was from starting out in my work career was actually in human resources and then in information technology while I was working as a consultant. And at some point, I got a pull to go in a different direction, and I sort of resisted that pull for a while, and then finally gave into it. And what that direction was really trying to look at and understand better how personally and how we as a Black community are engaged in addressing, again, these long-standing issues that just kind of you hear about wherever you go in the U.S. And so we know that there are historical factors that we have to deal with that cause that, but I just felt that it was something that, again, I was interested in understanding better. And that led me to do more work around community engagement and understanding how you work with community to address these issues. And while I was doing that, an opportunity to kind of focus on the health field, came to me, and I said yes, given that I was seeing that there was a need for such an organization as the Alliance. So I've been doing it for a while, and just will keep doing what I can to be part of the solution for as long as I can. So thank you all for having me on the panel today.
Yes, thank you, Marva. Thank you so much. And last but absolutely not least, allow me to invite Tracy Patterson to tell us about herself.
Thank you. My name is Tracy Patterson. My pronouns are she, her. I am a 21-year-old college student at CCP in Philadelphia, which stands for Community College of Philadelphia. My goal is to become a pediatrician one of the biggest things that stood out to me was seeing my family and the health issues they have and not really getting the help that they need in the way that they need it and in a timely fashion. So that's what inspired me. I'm looking forward to being part of the solution and not just picking apart the problems. So that's my goal and what I hope to receive from this conversation. So thank you all.
Thank you. Thank you so much, Tracy. And as Emmeline told you, my name is David Johnson and my pronouns are he, him. Okay, so I want to jump into it. And when you do the prep for these panels and we have some talking points, some things to bounce off of, and there's some info in there talking about different research that has been done to show evidence of the presence of racism in the healthcare system, right? And in healthcare practices and in access to healthcare. So I'm going to presume that we can move past that and just accept that that's a thing, right? And I would like to ask each of you, if you don't mind, to give a little bit about what you think can be done to build trust between the melanated, the non-white public and the poor public, right? The folks who have diminished access to quality public health. What can be done to build trust with those communities, and what can be done to undo some of the harm that's been done? I'll throw it to Tracy. I'll throw it to you first.
Well, I haven't had much experience in the category of seeing the health disparities for myself because I have never experienced it. But I have witnessed family members such as my great-grandmother and my younger brother go through situations where they weren't necessarily taken care of. But what helped in those situations was coming together as a community, showing that we do have numbers and we can speak up for ourselves is definitely a huge part of it. If you have people around you or you speak up for yourself and tell someone, no, I need you to explain something. I need you to tell me exactly what you're doing, what is wrong, how you're going to do it. Those are very important steps into changing the problem. I think coming together as a community and being a voice as a community is a big part of it. Because people giving solutions from side to side, not necessarily as a collective, is not helping as much. I think as we come together, we've seen it in most cases, people who come together and speak up and stand as a voice, it makes a much bigger impact.
Thank you. Thank you so much for that. Marva, would you like to offer your thoughts on this?
Sure. Just to sort of add, one thing I would first say is that, we talk about mistrust, and we have to recognize and acknowledge that mistrust is a result of mistreatment, and that mistreatment started from day one when the first Black person landed here on that slave ship. So the physical, the mental, health, the environmental, the lack of health care, that has been here since the beginning. And sometimes I would say if persons, we all need to do better in learning history and knowing each other, right? But if you don't know that history and you're constantly hearing, Black people are the worst in this, they're the worst in that, you might think, well, what's wrong with those Black people? So I would say at first step is that we all have to, be willing to look at the history, acknowledge it, and know why these disparities exist. A second thing I think that needs to happen in terms of the medical system of getting care is that there has to be work done to require some mandatory training for our persons in the health field who are already doing the work and those who are trying to enter into the health field so that they come in with some exposure and some knowledge around this. And David, you might, we served together on the CST, that was one of our, big pushes with the Dale Medical School is that, these are things that have to be core to learning to be a physician or already being a physician. I think also there have to be avenues when it comes to what do I do if I feel that I have been mistreated, or if the system has not served me in the way that I feel like it should be served? You know, what avenues do people have to really have those issues addressed within the healthcare system? You know, I know many people do surveys, quality surveys, asking, well, you know, how was your experience? But if I really have an issue, do I really get it acknowledged? And do I really see that there has been a result from that? So I think that's something that healthcare providers and systems need to look at. And then I guess finally, I would just say, when we talk about building trust and working together, you know, we know, again, that these inequities are not just about health, that in all of these other areas where there are inequities, they end up, you know, forcing or putting pressure on our health as Black people. And so where do we see the collective working together and the collective push to change these inequities in other systems that ultimately impact health?
Thank you for that, Marva. And you gave me a perfect opportunity to pivot a little bit, kind of unpack that a little bit and add some dimension with Jody and GE. So Joe, here's my question for you and for GE. Jody, I'll start with you. So we've just now, with both Tracy and Marva, dug into some of the aspects of race. Can you talk to me about how gender or gender identity or sexuality tends to play into the lack of equity and access to wellness?
Yes. So as a Black woman navigating the healthcare space, I have experienced, you know, unfortunately, discrimination. Oftentimes, you know, it wasn't until I purposefully sought out a Black woman primary care physician that uncovered like all these different healthcare issues that I knew I had all along, but my previous healthcare provider didn't believe me, or, you know, there's this thought that Black women can stand pain, and a lot of the concerns that I've mentioned, she kind of just like passed off. And we know, well, maybe we don't, but, you know, Black women in America are unfortunately suffering from a lot of Black maternal health issues. We have just, you know, a lot of low outcomes when it comes to our health. And so it's important to continue to amplify the voices of people of color, of women of color, and also the men too. You know, there's I feel like we need each other. Oftentimes women are the ones that, you know, if you're in a family structure that has a woman, she might be the one that's dragging the guy along to go to the doctor or making his appointments. And I think it's important to recognize that, and the power that lies in that, in creating change for health outcomes within these like Black family structures. And I also know that there are folks in Austin who are working to create spaces for both. So there are several organizations out there who are working on Black maternal health. I know Dr. Larry Wallace is creating the African American Men's Health Clinic. So we're fortunate to have people out there who are recognizing that and working to kind of do this work on a larger scale, and, you know, kind of highlight it for people who might not have known that these are issues. We kind of need a space where we feel safe. And, you know, that includes seeing people that look like us that are treating us. It brings about a different level of comfort when you talk about trust. You know, oftentimes, historically, these things were done to us by non-Black folks. And so, you know, you carry that down from years to years to years. There's people who don't trust, you know, healthcare providers because they view them as white people who are trying to harm them. So it's important to train up a whole nother generation of healthcare providers who are people of color. So, you know, kudos to you, Tracy, for what you're doing. It's definitely needed. And looking forward to amplifying the voices of the people who are doing this work, because there are people out there who are doing the work. It's just a matter of their voices being raised to the top.
Yes, thank you. Yes, thank you. GE, come with it. Tell me about what this looks like from your perspective.
Absolutely. So kind of taking some notes from what she was saying is like we need to be able to amplify these voices, you know, starting where the pain is, you know, being able to tap into those individuals or those communities where it's recognized and it is a need and it is an issue. And so being able to not only connect with that community and those individuals, but also to define, you know, how do we define a clear strategy, or who do we need to collaborate with to be able to create something that can be impactful for these communities long term. You know, a huge issue that we see kind of tapping into Black families is there needs to be something generational. You know, it isn't just with one family and one household, it's for generations to come. So how do we create something that can not disrupt, but redesign the way that we have conversations in our households and with our families to be able to say, yeah, mental health or health should be a focus and equity should be a focus. And how do we obtain it? How do we access it? So just taking some of those same points and saying that we do need to amplify those voices and focus on where the pain is in these communities, to be able to create solutions that are not only community driven, but can create an effect that lasts generations to come.
Thank you. Thank you so much for that.
David, before we move to the next question, could I just add one thing to? Okay, yeah, I would just like I echo everything that was said, and one thing that I would just add to that is that I think we also need to come up with some strategies to really understand and how to self-advocate when we go to physicians, and because we have to increase our numbers of you know, medical professions of color for sure. You know, I was, you know, blessed in a situation where I grew up, every doctor I had was a Black physician until I moved to Texas. But that's not always the case. And so we have to, I think, also figure out how do we create these structures within our community where we're supporting one another around how you advocate within the medical, you know, system, so that if something does go awry, I know, okay, I can call this person, or I can call this group, and they can help me through this. And because a lot of times we feel we are alone when we face those situations. So I think that's part and parcel with also, you know, creating our pipeline to create more, you know, physicians and just medical professions that are Black as well.
Thank you. No, thank you for adding that, Marva. So, you know, you're talking about like trying to create something different, right? And these different solutions. And I wonder all the time, why is it so difficult for governments to hand money over to community organizations and allow us to create and to dream creatively in the same way that private funding entities do, right? Like it's so much easier to get a grant to do something brand new from a private funder than it is to get the state to hand over money to do the same thing and do it bigger and better, or do it so it reaches more people. But one of the things I've noticed over the past couple of years while this pandemic has been happening is that systems have seems they've been exposed over the past couple of years, or the weaknesses in them. I like to tell people that I feel like the pandemic's made everyone a little dark, and made everyone a little browner, and put everyone a little lower on the socioeconomic scale. So if I could, Jody, would you mind talking about the changes that you've seen, both in how systems operate and in how systems appear to us as a result of the COVID epidemic?
Yeah, so it's interesting. As a fellow, I kind of am able to play an inside-outsider role within government. And so I definitely use it to my advantage. So there's this understanding that, yes, getting money through government systems is difficult and usually drawn out and delayed. And there are many reasons for that. I'm going to say the foundation of that is the inequitable system, an inequitable process that makes it difficult for the people who need the resources to get it. So that's like a huge undertaking by itself. And I can say, working within Travis County, like there are a lot of steps to different things, you know, where I might come up with an idea and I'm like, oh, we could do this thing. And then it's like, well, nope, it has to go through this and that and that and that. You know, it's like, okay. So that's part of the reason there are these systems that are in place that cannot be bypassed, that makes it difficult for people to have equitable access to these resources. But something that I've been fortunate enough to create is with the Vaccine Partner Program, is being able to use some of the funds from the ARPA funding, which is the American Rescue Plan Act, which is funds that are to pretty much rebuilding America through COVID, using some of that directly to bring into communities that are doing vaccine work or would like to do vaccine work, and making the process much simpler. So instead of these like very long grant applications, it's just like a one pager, like just the information that we need to make sure that we can like pass an audit pretty much. So making systems simpler, understanding that some community organizations don't have a grant writer. They don't have, you know, they're just a one-man show or one-woman show, but they need these funds. They need to be able to be supported in the work that they're doing. So creating simpler processes is creating more equitable processes when we're thinking about working with community organizations. And I wish there was a way to kind of just overhaul the whole system, but piece by piece, you know, GE mentioned disrupting, like that's part of this work, is disrupting the system, kind of having folks look at things a little bit differently. And that's part of my role here as a fellow, is to disrupt it just enough so that, you know, people don't have an uproar, but it forces folks to kind of look at things a little bit differently. Like, hey, you can still work with a community organization without giving them a, you know, 10-page grant application. Like it's okay, like we're gonna survive. So yeah, I think that's part of it. Just doing these, making little changes that show that community organizations can be trusted, and that they are able to do these things and be creative, and we're still standing.
Thank you so much. GE, can you talk about some of the impact on our communities, especially on your community or your communities, that this pandemic has had, ways that you've seen the systems fail and ways that you've seen our communities rise above and rise up against?
Absolutely. And I would, and my answer is definitely going to be more focused on, of course, my intersection of being a college student, Black and queer. For the communities that I've served, um, the pandemic hit hard because it was a shift. You know, for a lot of people, it was majority a financial shift. You know, people couldn't work in the same capacity as they wanted to or as they could. And it disrupted a lot for a lot of individuals that wanted or sought out stability. And so for me, the biggest hit that I saw was homelessness. Because for a lot of individuals in queer or BIPOC and cutie BIPOC communities, they weren't able to make rent. They weren't able to work or go to work anymore because a lot of small businesses or restaurants and stuff were closing. So that left a lot of pain towards a lot of individuals. And from that perspective, we also see that a lot of individuals in those same spaces, you know, tapping into homelessness, they couldn't support their family either. So you also have to look at it from a viewpoint of, oh yeah, you know, some people aren't able to get medicine or have access to proper healthcare resources. And so with this inequity that we're seeing within, from a wealth point of view, from like, oh, I don't have enough money to get the help and resources I need, definitely did hinder a lot of growth within these communities. And I know for me, a lot of my friends were heavily affected. You know, a lot of my friends were let go from their jobs. A lot of my friends were left homeless, where they had to live out their car in student parking lots. And even thinking about specifically my queer friends, there were a lot of issues surrounding health and wellness. Because with the pandemic did come a hit towards a lot of people's mental well-being, spiritual well-being. Um, and that kind of just goes back to that shift, you know, when COVID-19 came and we were stuck and trapped in our homes, it was difficult for us to navigate in that space and to find healing in that space. And so the biggest things that I recognized from the communities I serve and from my friends is one, homelessness, because a lot of my friends and a lot of colleagues I know of were homeless simply because they were not able to make rent. And I am glad that there, you know, were, you know, rent relief and mutual aid funds being created to supply that need. But it I would say that it created a spotlight for urgency in these communities to say, okay, what's essential? You know, our health, our well-being, our mindfulness, and how we navigate through these, and you know, and security as well. Um, so I hope that answers your question, but I think overall, looking at, you know, from my viewpoint, it was the hardest hitting thing was homelessness and that shift in mental health, as well as security, job security, financial security, and even relationship security. You know, how can I be able to sustain or grow relationships because a lot of people started becoming disconnected. And so that's what I've recognized. And that's the impact I've seen from COVID-19 in the communities that I serve.
Thank you, GE. Thank you. Tracy, you had your hand up. I saw you, homie. Please give us what you got to give.
I just wanted to circle back a little bit to the point that you made in the beginning, which is why don't these systems don't get any funding. And I just wanted to highlight something that I experienced with my cousin, and it was the Black Doctors Consortium that was in Philadelphia. And there was a whole big rollout for it, saying that they were going to have supplies because of the weather. It was the winter time. They would have heaters, gloves, food, and water for people. And they had all these systems, the government and the state government and the city officials agreed to give out these things and help fund this rollout for their 24-hour clinic for vaccines. But when we got there, we stood outside for 12 hours in freezing weather for a vaccine. And there was no water until you got to the front of the line. There was no bathroom for any of the people to use. And these are all, they focused on the Black community. So you have people with underlying conditions standing out. And everyone online agreed that we would call council people to come out and help with what was going on. And we did, and only one person showed up. So that was just a huge highlight for me on how we don't fund these systems at all. We don't give any help. And they see that our community is struggling, but they don't care as much. They say they'll do things, and then when things are supposed to happen, they roll it back. And there was an article that my aunt wrote about this, just highlighting not only that this happened, but also pinpointing our city officials and telling them they need to really pick up the pace and do their job. And I think that is a huge part of helping the medical community and building trust, because we do have these Black doctors that are willing to help, but it's all about the funding and how they can actually get it done.
Thank you, Tracy. Tracy, if I may ask or start another question with you. So can you talk about, in your experience dealing with you know, our community, your community in Philly, and trying to support access to vaccinations and just trying to support access to what we need during COVID, right? Have you seen any reluctance or resistance from Black and brown folks from getting the vaccine to begin with that might be tied to like generational or individual trauma with the medical system? And if so, what does it look like to you?
Absolutely. I faced a lot more resistance from the younger generation, my generation, in getting these vaccines and actually going to the doctor, because we've seen the disparities over the years with our parents and grandparents and cousins and aunts and uncles. So when you constantly see the health disparities and the wrongdoing and the mistreatment of people that look like you, how do you have that trust to actually say, oh, I'm going to trust them and trust what they're doing and accept the fact that this vaccine is needed? And I definitely faced some problems with my own family wanting to get it because they've gone through their own mistreatment and didn't really trust the system, didn't trust what people were saying. And the media coverage and media online did not help because it wasn't accurate and factual information. So my role as a person who's in this community, for me, it was finding the information that was factual and presenting it to people and allowing them to make their own assumptions about it, supporting them through that and helping them know that I have your back no matter what you choose, because it is your body and your choice, but also giving them the information so they can make a informative decision on what it is that they're doing.
Thank you. And I'm going to speak up and say full transparency. My family were vaccinated, but we did not get vaccinated until after that first round had gone through and some time had passed. And because of, the work, we could have been vaccinated early on, but I needed to see all the folks that had access take that vaccine and see what it did first. and I'm saying that out loud because to some people that may seem absurd, or that may seem like like some type of imaginary concept, but that's a real thing. That's a real thing that's rooted in trauma that I've seen in my community and I've experienced. Marva, can you, jumping off of what Tracy just said, can you talk about how misinformation, weaponized misinformation, has impacted our community and our community's ability to pursue and access wellness, especially during COVID?
Yes, well, the misinformation certainly has played a role in the I guess lack of willingness, to get the vaccine, again, based in reality of things that have happened. But when you have then misinformation on top of that, it really, makes the problem, even tougher. What we've tried to do in community and persons that we have, interacted with is to, provide sources of accurate information. I think here in Austin, we were fortunate, I think, even though, there were challenges at the beginning in terms of even, say who even had the access to the vaccine, even if you wanted it, at the beginning. A lot of our elders were willing to get it, understanding that, they were in a high risk group. But I know even with my family, trying to even get the vaccine was a challenge when it wasn't as readily available. And then even, the systems that were put in place to for you to access it, everything kind of, being online, that was an issue. But in terms of, the misinformation, I think we have to do a few things. One, we have to identify what are the sources of reliable information and make those readily available. And it can't just be one. People are going to make their own decisions. At this point, if persons who aren't vaccinated, it's certainly a choice not to be vaccinated. And again, no, you don't, put a person down. Everybody has to make their own decision. And, some people make it, because they, have different reasons. For some people, it's religious beliefs. For some people, it's, the thought that, well, I, do these things to keep my body healthy, and therefore, I'm not going to, I can make it without, the vaccine. But the ability to have trusted sources, have those trusted sources in multiple places, and then just encouraging people that when they hear or see something, on social media, really look at the source that is providing that information before you act on it. If someone is putting out information trying to cause you to take a particular action or not, then look at where that's coming from. Ask yourself, can I verify that anywhere else? Maybe, do a search on whatever it is, and search for, like, is this fake? Is this a hoax? And really try to get to that point of understanding, because I personally don't think we can stop misinformation, not in this day and time, not with social media and even our traditional media, right? Sometimes you even have to fact check some of that information, or even think about the fact that, okay, they're telling me maybe a certain side of the story, right? Either because of, their persuasion as a network, or, who funds them, or where do they get their dollars from. That sometimes can impact, the lack of, information that you get from what we consider our traditional sources. So it's a problem that, unfortunately, it's not going to go away. And all I think that we can do is to, try to put forth and point people to, and then within, what are some reliable sources, and then within smaller networks. I mean, the best influencers around, I think, the vaccination are going to be, people who you trust personally. And then also, I think, David, you made the point of, like, see what has happened to people who I know have gotten the vaccine. So it's, at this point now, there are more people who've been vaccinated, and there are fewer people who have had adverse reactions because of the vaccination than there have been people who have died from being unvaccinated, right? So when you maybe point things like that out, that can help break down that misinformation that people are getting, when they can, position that against the reality of what is actually happening.
Thank you, Marva. I'm gonna go off script a little bit because it's live, so what are you gonna do? So I want to throw a question out to everyone who's bouncing around in the chat. What do you think about the impact of COVID on our incarcerated community members? I'd like to see you throw in the chat your thoughts on that. And I would like to ask Grant, GE, the need to organize in the community to build confidence and trust in the vaccines, and to build interest in even wanting to take advantage of vaccines when they're made accessible, when they're made available. What does that look like from your point of view in order to be effective and to have a lasting impact on our community and our community moving towards wellness?
Absolutely. I would say that creative collaboration and then digital storytelling. I've always been an advocate for digital storytelling because it's able to tap into the needs of the community and identify community members and leaders, those affected and unaffected, to maybe tell the story of the community and the needs of that community. So I would say collaborative creativity, in the sense of we need to collaborate and we need to be creative about the solutions that we develop in the spaces that we curate. Too often are a lot of individuals discouraged from creating community action because they feel like there isn't a community to be built, or that the need isn't as urgent or essential to the community that they want to target. But I always encourage people to take that step of faith, because in these communities, it's one person that can create the change. It's a group that can create change. And for me, the most effective way that I've seen change being created is from storytelling, from tapping into the community for those being affected and not affected, and getting the viewpoints. And for those who are affected and you are collecting those stories, how can we tailor that story to be able to be actionable? How can we hold forums? How can we have town halls? How can we get political figures in our community who hold power, who have influence in their voice to be able to create that impact in our communities? I believe it was said or mentioned a few moments ago that in our communities that there is disconnection, that there are times where propaganda messaging will be weaponized in an effort to discourage us as leaders in our community to creating the change. But being able to collaborate creatively and be able to tap into digital storytelling. And for people who are unfamiliar with, digital media or social media, storytelling can be done without social media and without digital media. It's as simple as creating, I'm not gonna say simple as creating an event, but being able to say, okay, we can't do storytelling. How can we get individuals to share their testimonies live? How can we have an open roundtable discussion about the needs in our communities and how we can create these solutions? So there's always a way to be able to implement storytelling from a virtual or in-person standpoint or a social media standpoint to an in-person interactive engagement standpoint. So for me, it looks like turning stories into action. And from that action, we can create policy. We can create ways to spotlight and develop, what to call it, not strategies, but I guess you could say going back to solutions on developing that access to opportunity to be able to get the vaccine or to be able to get resources and tools that can build you and your peers or your family or who's ever been affected. To be able to build that strong community that you can lean on for support, for help. And so to answer the question, just to reiterate, it's all about creative collaboration and digital storytelling or storytelling to be able to turn those stories into actions or turn the needs of the community into tangible action, to be able to hear what the community needs or what the community wants from, going back to the political leaders or the people who have the influence and who have the voice that can allocate the said resources and tools to be able to create the change.
Yes, thank you, GE. And Jody, I have a question for you, but I wanted to honor that Tracy had her hand up a moment ago, and I know Tracy got something to put in here. Tracy, you have the floor.
Thank you. I just wanted to go back to your question of how it has affected the correctional system, COVID. I personally have a brother who is incarcerated right now, and I've seen the impact of it. I've talked to him over the phone and asked him how things have been going as far as COVID in the facility. And it's a lot of infection rates, it's people piled on top of each other plus the infection rate. So it's much higher than normal. And the fact that a lot of the employees there are also not vaccinated, they don't really require them to be vaccinated, plays a huge part in the infection rate, because yes, you have these group of people who are not allowed to be outside or have visitors now during COVID, but then you have correctional officers and people who refuse to get vaccinated coming into the facility and exposing people. So I think highlighting that and really making sure that we keep them safe and protected while they're there is important as well. And I don't think people have thought too much about how it has affected the people who are incarcerated. They just think about the people who are on the outside and they don't really care as much who's in jail or who's incarcerated. And I think it's important that we really take care of everyone that's going to be affected by this disease, and that is everyone in the world, whether they're incarcerated or not.
Thank you. Thank you so much, Tracy. Jody, the question I wanted to ask you, I wanted to talk about maternal health for a moment. Is that cool?
It's not my area of expertise, but sure.
No, the reason, Well, no, but I wanted to bring up maternal health in the Black community, right?
Mhm.
What does it look like for mothers and for mothers and their young children right now in trying to access vaccines and try, especially when we talk about the members of our community, the ones that are so young that vaccines aren't available to them? So what does that look like from your perspective?
Yeah, so as Marva mentioned earlier, the access to the vaccine has certainly expanded from what it was in the beginning. And I think that what we're still fighting is it's twofold. There's the hesitancy and the misinformation. So I think that, you know, and there, okay, so there's other things as well. So we think about people thinking about the side effects from the vaccine, and so like that preventing them from getting it, because it's like, well, I can't afford to be out from work for 2 days because I'm down from taking this vaccine. So they just like don't get it, especially if you, like you mentioned, a mother and she, you know, has her family to take care of, or another person to take care of. That has prevented people from taking the vaccine. So that's where, you know, different policies come into place with employers. And I know there's, I'm going to get their name wrong, but it's like the Hispanic Construction Association or something, has kind of worked with various groups to try to reduce the financial impact for people who have to be out after taking the vaccine, and really supporting that. But yeah, the access to the vaccine is there. I think it's just people feeling comfortable with taking it. And, you know, I've been to many vaccine clinics and many different environments, and it takes time. I think it's important for community organizations and individuals who are doing vaccine work to just show up and keep showing up and be there and be a presence, because sometimes it takes a person 3 or 4 times before they make that decision to get the vaccine for themselves or for their child. And what we're seeing now, while a lot of vaccine clinics aren't, you know, as jumping as they were when boosters first came out, when Delta first came out, there are families that are coming in. So people who waited to get the vaccine until they knew that their child would be able to get it. You see multi-generation families coming in to get vaccinated. So I think that that is an interesting kind of concept, trying to like wrap my head around, that folks were like, you know what, I'm not going to do this until I could be sure that my child can be safe as well. And they purposefully waited until pediatric vaccines came out. So are we going to see that same kind of trend when vaccines are available for younger children? Possibly, you know, possibly. Yeah, sorry, I don't have like too much insight in it, but yeah, just from what I've experienced.
No, so here's the, and my apologies, I should have said more of the combination of maternal health and family health and parent-child and multi-generational like dynamics, right? You said, oh, I really don't, and you gave exactly the answer. I was like, oh yeah, I asked the question wrong, and then look at Fam giving the answer that I was looking for. Like real, yeah, real G slip sometimes. Like so we have a few minutes left, and here's what I would like to do. You know, usually we say things in panels like, oh, and if you have a final thing you'd like to say. Look, we all work in community work, whether it's a standalone 501c3 or it's a community project that's still getting its feet up under itself. And so what I would like to invite each of you to do is to name one thing, be it a project that you already know of, or a project that, whether it's your project or not, or something you would like to see funded and pushed out, something that you know the community would like to see that would definitely have a positive and lasting impact on the health and wellness in an equitable fashion of our communities. So I'll let somebody just jump out there, because I've been traffic copping and I'm done. So if someone has an answer, just jump on out.
I can start. So something that I would love to see, as I mentioned before, I'd really like to focus in on African Americans getting the vaccine. For those who don't know, African Americans in Travis County are only 34% vaccinated, which is the lowest of all the ethnic racial populations. We are the lowest. And so what I would like to see, to GE's point from earlier, is a collaboration of organizations, not just Black health organizations, but African-American organizations in general. So sororities, Black Lawyers Association, Black Chamber of Commerce coming together and using their platform and their resources to try to push for more African Americans to get vaccinated. So I'm currently working on a campaign with that and hoping to get, if people want to be a part of it, let me know. I would love to continue to elevate that.
Thank you. Thank you so much. And no, I'll be emailing you after this. Anyone else want to jump out?
Yeah, this is Marv. I'll go next. I would be interested in seeing some type of effort around educating and really helping people to know how important their vote is when it comes to trying to dismantle health disparities. We have situations, and we talk about systems that, policies are in place that impact systems that prevent us from really taking down some of these barriers. So here in Texas, for example, the inability to pass Medicaid expansion has a huge impact on the number of people who have access to care. That's not going to change unless there are people in office who have a different way of thinking, who vote differently. We look at what has happened just now with restricting access to abortion, and we know who that disproportionately is going to impact, right? So a woman's health, her issue, making her choice, has now been, and not to make this into a political forum, but it's just so much that it's impeded by policy, right? And until we can get some changes in certain areas, that's going to continue to happen. So how do we create a system where everybody, we can't all be in tune to every issue all the time. There are too many. So I always say to people, just pick one. Don't try to, be the expert in everything, because we can't, but just pick one thing. And how can we have again, a system that makes it easy for people to know, okay, this election is coming up. I have a choice between A and B. I can see how A has voted on this thing in the past, and this is an important issue to me. Therefore, I'm gonna not vote for A, right? How do we get the messaging, the information to the level that it's easy? And it can't just be at election time either. How do we follow these issues consistently so that then when it comes time to make a vote, we have garnered the necessary, community effort to get people out to vote, to change some things. I mean, the vote is just critical. So I'm sorry I went on too long. Let me be quiet, give someone else a chance. We run up against time. I'm sorry.
I love you, but no, thank you for that. Thank you. Who would like to go next?
I'll go. My answer is kind of very simple. Because I was a part of Brave Communities, which is in Austin, Texas, I would like to see it expand more into Philadelphia, and I would definitely be a part of helping that expand into Philadelphia. I was able to be in a group where I did have one other person from Philadelphia who was here in Brave Makers and is also an alumni. And I saw the impact that it had on us as young people. So I know how greatly it can impact the community and help us. And I've seen the effects that it has in Austin. So I know what good it can do here.
Thank you. Thank you so much. And last but absolutely not least, GE.
I think we lost GE.
That's unfortunate. I apologize to everyone that it seems we've had a technical difficulty and lost GE. I will offer up, because I was going to offer this anyway, just so we're sharing in this honesty and vulnerability. The thing I would love to see, recognizing that local government has a greater impact over our day-to-day lives than state or federal tend to do. I would love to see the county, Travis County is where I am, put in place a body that has teeth, that has decision-making authority, and is able to hold the county accountable, right? Around healthcare decisions and funding decisions. But here's the key. I don't want to see it populated by people that are employed by the state or in the way that it's traditionally done. If there need to be a couple of people from the government, throw them on there. But what I am tired of seeing is groups that get together and they hold 1 or 2 seats for truly directly impacted folks who are at the heart of the issues, right? And so their voices get drowned out and tokenized, and then things get pushed forth and we're told, oh, we had community input. No, I would like to see the county trust in its own community and allow a community-driven and community-centered body tell them what to do around health. So that's what I would like to see. And with that, that is time, maybe a little bit over. Jody, Tracy, Marva, GE, if you can hear wherever you are, thank you so much for this opportunity to speak to each one of you, to ask you questions. Thank you for your honesty and your authenticity. Emlyn, thank you for allowing me to facilitate this panel. And for everyone paying attention right now, this is the end of our panel discussion.